Hello, and welcome to the lecture on ethics in assessment. I'm going to breeze through some of the ethical standards for ACA in regards to the topic of assessment. You'll have an entire class in ethics that'll cover all of the sections of the ethical guidelines. But I thought just in the case of this course that we could at least touch upon assessment ethics to some extent. So let's get started. And all of these ethical guidelines are the ACA ethical guidelines of 2014, and they're located in Section E under the title Evaluation, Assessment, and Interpretation. And this is what we're going to talk about, and I'm going to kind of read some of these and then just offer some further explanation. I would say that the majority of these guidelines are just very common sense type guidelines that do have gray areas, of course, as most ethical guidelines do. And I'm just going to try to offer some examples maybe. So the primary purpose of assessment is to gather information, whether in order to make decisions about how to proceed with one's clinical care. The ethics can be both qualitative and quantitative in nature. And in this class, we will cover some qualitative methodologies, namely the clinical interview, and then the quantitative methodologies, which is going to be psychometric instrumentation. But that's pretty much what the whole purpose of assessment is. Regardless of how you're assessing, it's to gather information and then make decisions on how to what would be best for the client in terms of moving forward. Always take into account client welfare, that counselors don't misuse assessment results and interpretations, and then we take steps to prevent others from misusing the information provided. That we do what's in the best interest of the client at all times, and we do no harm. Limits of competence. This is one that we need to pay attention to in terms of that clinicians only use testing assessment strategies and instruments that they've been trained and are competent in. So what does this mean? It means that that you can. It's basically staying within your scope of practice. That if you were tested in basic assessment skills, then you want to stay primarily in that arena. That you don't want to jump into something that might be more advanced that you don't quite understand or have been trained in. Now, that doesn't mean that you can't learn more about clinical assessment and advanced instrumentation. It just means that if you want to go out and get trained in it. And how we get trained in different forms of clinical assessment really depend. That you could take seminars, you could go in for additional coursework, or also you could purchase an assessment instrument, read through the manual, and work under somebody who knows how to administer, score, and interpret that test, and work under them for a number of times that you administer that instrument. I think I'm not really sure what the number is anymore. I remember when I went to grad school, it was like you had to do it like maybe 8 to 10 times, or before you could be seen as competent. I would probably say 15 to 20 just to be safe, so that way you know what you're doing. I remember in my doc studies, I took an intelligence test course where I gave out a number of intelligence tests, and I wanted to do it so many times so I would be seen as competent in doing it. So we just need to make sure that we know what we're doing and we're doing it right. The appropriate use, that counselors are responsible for the appropriate application, scoring, and interpretation of an instrument. So you just need to make sure that you're following the directions of the instrument. That you don't go off, unless you have a really good reason to, that staying on, following the directions of the instrument could actually be detrimental, but you got to have a good reason. So just make sure you're using the instrument appropriately, and also for decisions based on results, that counselors are responsible for decisions involving individuals or policies that are based on the assessment results that have a thorough understanding of psychometrics. So we need to understand not only what we're doing, but we have to use these things appropriately and know what the numbers are telling us and be able to make decisions based on that. Informed consent of assessment. Always, clients always have the right to know the results of a clinical interview, a diagnostic assessment, or of the scores and interpretations of an instrument. At the same time, you can't just hand them all of that stuff and say, here it is. You have to sit down with them and you have to explain it to them and use language and terms that they're going to understand. So they have the, so they get it and they, and so they'll be able to understand, what these results are. Release of data to qualified personnel. That's basically, you don't share, this has to deal with confidentiality, that we release assessment data only at the consent of the client or the client's legal representative, so or legal guardian. So, the assessment data it has the same level of confidentiality and that the client notes, or the diagnosis, or anything else. So, it really depends on what you're doing the assessment for. If it's, if it's for like some kind of a mandated thing where you need to assess somebody for, let's say, a substance use disorder for the courts, that's one thing. But, at the same time, if someone comes in and says, I want some counseling, and you do a clinical interview and give them some instruments and you come up with a diagnosis, that, that information should be held confidential. Instrument selection, always, use instruments that are appropriate for, for the case. That you have to consider the quality of the instrument as well. Does it have validity, reliability? What are the psychometric limitations? The appropriateness of instruments when selecting assessments, like which one is going to be, which is the best instrument. There's a lot of instruments out there that measure the same construct, but they do it in different ways, and the constructs might be defined differently. And you'll, as we move into psychometric instrumentation, you're gonna have a better understanding of that. So always be sure that you're using the appropriate instrument for the case. The conditions of administering an assessment, especially an instrument, is that we administer assessments under the same conditions that were established in their standardization. So the thing is that we have to read the directions carefully. And if the directions for the instrument says that this should be administered in a group format, individual format, or you can do either or, but it has to be in a quiet place that's well lit and free of distractions, things like that. That you need to be able to to follow that, such as provision of favorable conditions, like I said, in a private room that's comfortable, free from distractions. If there's a technological administration that we, because a lot of people are going to, putting these instruments on, not online, but administering them electronically. So somebody gets in front of a laptop and then they complete something there, and you have to make sure that that you're doing that correctly. Multicultural issues and diversity in assessment, that we have to be mindful and use caution in terms of which assessment techniques are normed on populations other than that of the client. So what does this all mean? That we have to make sure that the instruments and the assessment strategies that we're using have been normed have been normed on groups that are appropriate for our clients. So, one example that I have is, I remember, and this is about psychometrics, but it's based on research. I remember reading this research article once that was examining the spirituality of African American males, and it was a quantitative study, and they used a spirituality instrument to assess that. But the assessment, that the instrument itself was normed uh, all on white people and not on any other group or the other racial group. And this was an issue of validity, because how could you have how could you examine this the spirituality of Black males when using an instrument that was only normed on white people? So we need to be very mindful of that the instruments that you use and the assessment techniques that you use have been normed on not just one group but many groups. So scoring and instrumentation and interpreting of assessments and reporting, that that when counselors report assessment results, they consider the client's personal and cultural background, level of client's understanding of the results, and the impact of the results on the client. So when we report these, we have to take a lot of that into consideration. Instruments with insufficient empirical data. One way to avoid this is just use the best quality instruments that you can. And sometimes instruments, there's not going to be an instrument out there that's perfect for a specific construct that you need to measure. And I think if you use an instrument like that, you have to take it with a grain of salt. You can't necessarily put a whole lot of weight into an instrument that is not valid, or maybe even reliable, or not even normed on the right group, using the right groups. Assessment services, that counselors provide assessment, scoring, and interpretation to services to support the assessment process, confirm the validity of such interpretations. That they accurately describe the purpose, the norms, the validity, reliability. I mean, all of these have to be in line. We have to make sure that all of that is, all of that is in check. Assessment security. This is, this is just basically keeping, maintaining the integrity and security of tests and assessments, and using it within the contractual obligations when you purchase one. That and a lot of this might be copyright types of issues, that you don't appropriate, reproduce, modify published assessments. That you purchase what you use, and you don't make copies after you purchase it. Like you purchase one assessment instrument and just one copy of the of the assessment, and then make 1,000 copies, because that would be illegal. Okay. Assessment construction, that's more if you're going to create an assessment instrument, and it's not really for the purposes of this course. Okay, so this was pretty much just a quick run through of assessment ethics. Once again, you're going to get this in a more in depth in a specific in an ethics class, but I thought I would just run through this just quickly. So if you have any questions, please let me know. If not, have a good day.